Hello and welcome. I'm Josh Schimmels, publisher and CEO of the Los Angeles Business Journal. It's exciting to be here today, hosting another healthcare roundtable discussion. As we know, the healthcare industry as a whole has faced incredible array of challenges over the last few years, but it's rallied, it's made improvements, it's made enhancements, and it's made adjustments to protocols, all while providing services that are the most essential to those in need. Responsibility has ultimately fallen squarely on the shoulders of the healthcare sector in order to lead the way through the industry's new normals, while providing answers and best practices for the people and the businesses of the Los Angeles region and beyond. To better explore the many pressing health-related issues, the Los Angeles Business Journal is joined today by 4 healthcare experts and thought leaders from the region for a roundtable discussion. We're going to cover insights, suggestions, and best practices. Before we launch, I'd like to say thank you to all of our partners, Eminent Health, PIH Health, Providence, and UCLA Health. We appreciate you being a part of this discussion, educating our audience, and all that you do for our community of business. All right, we're going to get started. I'm going to introduce our speakers, our panel. Dr. Lopez, Senior Vice President, Chief Medical Officer, and Chief Strategy Officer with PIH Health. Michael Ricks, Chief Executive, Los Angeles Coastal Service Area, Providence South Region, and Chief Executive with Providence St. John's Health Center. Roger Sharma, President and CEO, Eminent Health. Johnny Spizzo, President of UCLA Health, CEO of UCLA Hospital System, and Associate Vice Chancellor, UCLA Health Sciences. And joining us today for our moderation, Ellen Mazin. She's the National Advertising Director here at the Los Angeles Business Journal. Ellen, handing it over to you. Welcome.
I'm excited to be here today with this esteemed group of healthcare leaders and discuss your insights and challenges facing healthcare today. Okay, let's get this roundtable kicked off with a question for the group. Based on what you are seeing today, what is your outlook for the future of the healthcare system in Los Angeles in 2024 and beyond? Dr. Lopez, we'll begin with you.
Hospitals and health systems across the nation continue to face financial challenges caused by a variety of factors, including rising cost of supplies, medical devices, pharmaceuticals, and of course, labors far exceeding reimbursement from public and private payers. Strategic planning for cost containment, revenue diversification, and the development and implementation of innovative growth strategies with an increased focus on sustainability and resilience are the key to continued growth and success in healthcare organizations like ours. At PIH Health, this year has been one of embracing those changes that are affecting our organization and finding new ways to grow forward. We are developing a new strategic plan to lead us into the next 5 years, which will set the foundation for a better future for our system, our patients, and our community.
Well, thank you, Dr. Lopez. Michael, please give us your thoughts.
Yeah, thank you for that. I think that the future is there's a mix of ongoing, challenges and emerging opportunities like Dr. Lopez shared. For example, adding on to what he said, there's challenges including workforce shortages and burnout. He highlighted the increasing cost of care and reimbursement that just doesn't keep pace with those increasing costs, even policy and regulations that continue to shift some of the overwhelming economic burdens to providers of care. But on the flip side, on the positive side, the future is very exciting because I think of advancements in technology like artificial intelligence. There's research that will result in cures for certain diseases, no doubt. And there's greater awareness of some of the healthcare disparities, and sustainable efforts are in place now to reduce and even eliminate some of those disparities. Those are some of the exciting things and promising advancements that are taking place now and into the future for healthcare.
Wow, that's very interesting. Roger, could you weigh in a little bit on this?
As Michael and Rosalio mentioned, the outlook for healthcare systems will be transformative. We will have to transform our clinical and business models to meet with the challenges and opportunities of tomorrow. The positives are, as Michael also mentioned, that the new technology and new emerging treatment protocols and the new techniques that the physicians are developing will lead to better care for patients. What is going to be challenged is the medical economics or the healthcare economics portion, which has been challenged for quite some time. And the underlying reason for that is the rise in government-funded healthcare, and government doesn't pay cost, whether it is Medicare or in our state, it's Medi-Cal. So that's one of the key drivers of it. Then the second key driver of challenges is the rise of delegated medical groups. Insurance companies have transferred the risk to delegated groups who try to squeeze cost and also on top of that, influence the steerage of the business to the healthcare system. So you combine all this, still insurance companies view hospitals as drivers of cost. So that is the reason why I mentioned that the outlook is we will have to transform our clinical and business model to meet with these challenges. And almost every healthcare system is engaged in that transformative journey.
Well, thank you for those insights. Johnese, we're interested in your opinions as well.
Well, thank you. I agree with all my colleagues on what's been said about some of the challenges and opportunities. And I would say, certainly as a very large academic health system here in Los Angeles, we see that really in every aspect of our work in clinical care, in conducting the latest scientific research, and in training the next generation of healthcare professionals. And we're continually, moving forward with advances. I think the challenges of working in an under-reimbursed system is something that we're all feeling the challenges of, and how we continue to move forward and expand access and capacity, and yet have limited capital resources to do that. Here in Los Angeles, serving a population of over 10 million people with some of the biggest health disparities in the nation, I think we're all looking for creative ways to do that. And I think one of the biggest opportunities we're seeing is some of the breakthroughs certainly in our scientific institutes, what we've seen in breakthroughs in cancer therapies with the CAR T cellular therapy, things that we're seeing in our neurological institute, ways of treating patients and really eliminating lots of disability and suffering that patients were encountering before. And then with the advances in artificial intelligence, we are seeing how we can deliver more precision healthcare, make things faster, safer, higher quality, and hopefully more efficient as we go forward. So I'm excited about the future of that.
That's great. This is a very intuitive look into the future, and thank you all. We'll be getting into a lot of these issues in our discussion coming up. Shifting our focus to a national perspective, Roger, how does California's healthcare outlook differ from other parts of the country? But I'll need you to unmute.
California is always different when it comes to anything that we try to do. But there's few things which are very unique in healthcare system in California as compared to other states. Let's start with the ban on corporate practice of medicine. That's very different in California as compared to others. Now, systems are figuring out the foundation model to kind of moderate the effect of that, but there isn't. Second, the penetration of managed care in California is much higher historically and even today as compared to other states. Other states are catching up, but managed care is a big influencer in California. The third biggest thing is that California has a very large Medi-Cal program. A very large proportion of population of our state is covered by Medi-Cal. And Medi-Cal is one of the most underfunded state-sponsored or state-funded programs in the country. Now you do the combination of a state which is a very high wage and very high cost state, and a state where the reimbursement for Medi-Cal services is probably one of the lowest in the country. It creates very unique challenges for the healthcare system in California, and particularly in communities where Medi-Cal is high proportion, this is high. The last one is our biggest cost component is labor, because healthcare is delivered by people. And because of the the influence of labor unions, the cost increases on labor are far higher in California than we experience in the rest of the country. Now, this, sometimes I wonder, with all these things, how are the hospital systems in California still surviving? And there is a reason why they're surviving. On the positive note, California has very large population centers, so the demand for our services is still there. That's one positive. And second is talent. California has positive in the sense that you can acquire talent in the state. There's some very intelligent people, great universities, so you can build programs, you can innovate, you can transform. So that's, I would say, how things balance out in our state.
That's very interesting. I mean, the managed care, medical programs, cost and labor, but the positives are that, the talent is abundant. That's just great to hear. I want to move over to Michael and Janice for this next question. New research reveals increased incidence of cancer among adults at younger ages. How is your organization responding to the ongoing challenges of combating cancer in our community? And I'll start with you, Michael.
Yeah, thanks, Ellen. I think there's multiple ways that Providence is responding to the ongoing battle with cancer, and I'll just highlight one area that I'm very proud of is our partnership that we've had with Stand Up to Cancer to focus on improving screening rates in colorectal cancer, which is, many of us know, is the second leading cause of cancer mortality in the United States, but especially in our Black and Latino communities within Los Angeles. A couple of years ago, we were awarded a grant from Stand Up to Cancer to conduct a multi-year study designed to chart a path forward, addressing racial, ethnic, and those socioeconomic disparities in cancer screening and in early detection, but not just in older people, but in younger people as well. And I think through this project, the St. John's Cancer Institute partnered with local leaders in Los Angeles and Santa Monica to build and launch and support these community health action teams. We also call it an acronym, CHATS. So these community health action teams are chats where these local residents were trained as chat leaders to inform their own community about colorectal cancer, promoting screening, and then navigating some of the challenging healthcare resources that are available. And lastly, an extension of that effort is to combine clinical and genomic factors that really drive early onset of colorectal cancer, and using these digital spatial genomic profiling technology that's available at St. John's with a wealth of additional clinical data from across the entire Providence health system. And by identifying those molecular mechanisms that are driving this early onset, we can really develop targeted strategies to screen for and manage colorectal cancer in many young adults.
Wow. It sounds like multi-detection screening and early detection are important in younger people. Janice, how is UCLA Health responding to this?
Thank you. Well, and UCLA Health operates one of the largest nationally designated cancer centers in the country, an NCI designation. And our researchers and scientists at our UCLA Johnson Comprehensive Cancer Center research continue to pursue new discoveries, particularly around where they're seeing an emerging increase in the incidence of cancer diagnosis. So that's not only in the rising incidence of colon cancer in younger populations, but also in the rise in blood cancers. And our physicians participate in conducting clinical trials. We have over 100 different clinical trials for cancer here, which monitor the effect of earlier consistent screening for those at higher risk. We also reach out to our underserved communities and have a partnership with the community health centers to really advance colorectal cancer screening, breast health screening throughout the community. And all of these efforts really come together to also help inform some of our researchers on which areas to pursue as they're bringing in NIH grants and others to look at new breakthroughs. And over the past decade alone, UCLA has brought forward 14 new cancer drug therapies. Herceptin for breast cancer was developed here. So we continue to really look at ways to not only diagnose, but also treat the most aggressive forms of cancer. We were one of the lead agencies that brought forward the CAR T cellular program. And now I guess what I would say from, being in healthcare now for over 35 years, the most exciting thing I think is that cancer is no longer a fatal diagnosis that it used to be when I started my career as a registered nurse. And now we see people with very advanced stages of cancer who are having that treated like a chronic disease. And I think, the most important thing that we can do is always bring hope to our community. And I really believe research is the hope for the cure. And I believe, after seeing some of the work that we are doing here in the UCLA research centers, is that we will see cures for some types of cancers in our lifetime.
Wow, that is amazing. And congratulations to both of you. And thanks for sharing for all that you're doing to combat cancer and of course, all of your health systems. Dr. Lopez, let's dive into preventative measures. What are some of the evolving best practices in terms of prevention and early diagnosis as ways of stopping serious illness?
Cancer diagnosis, as was stated, in people younger than 50 has been on the rise due to a number of factors: awareness and early onset cancer detection, celebrities speaking out about their cancer diagnosis, the media, and of course, dramatic efforts on the part of organizations represented here to expand our outreach to identify populations at risk and ensure that we are doing our very best to screen them as early as possible. And those best practices have been evolving over the years in response to the increasing types of cancer cases in young adults and in the population in general, revealing just how important effective preventive care is in dramatically reducing the disease burden of cancer as a whole. The example that was cited, colorectal cancer screening for people at average risk, now it's recommended to start age 45 instead of 50. And in 2023, the American Cancer Society updated their lung cancer screening recommendations, expanding the pool of current and former smokers who should be screened every year starting at age 50 for lung cancer. Additionally, in early 2024, the United States Preventive Services Task Force updated their screening guidelines for breast cancer to begin at age 40 in alignment with the American Cancer Society guidelines. At PIH Health, we have 3 different hospitals. We have over 35 clinical sites and our own clinical research program. And so we are expanding dramatically our efforts to outreach to our communities at large to ensure that populations at risk are properly screened. And so those efforts, in addition to our updated treatment guidelines, as has been stated, I believe are also increasing the idea that cancer at some point becomes a chronic disease. And due to the targeted therapies that we're implementing, eventually become a much more effective way of treating cancer as a whole.
Well, thank you, Dr. Lopez. I mean, it is so important for patients to go in for screenings, and it's such a benefit that we have social media now and that celebrities are bringing awareness to this. So that's great news as well. Great information. Prevention and early diagnosis are a key. Michael, looking at the bigger picture of community healthcare, how are healthcare organizations committed to creating a healthier community overall?
Yeah, I'd say at Providence, but also all of the organizations that are represented, here today on this panel, we all believe that healthcare can't just happen inside our organizations, but outside, the walls of our hospitals and clinics as well. And in order for us to really maximize or achieve maximum impact, we conduct a community health needs assessment every 2 to 3 years in all of the communities that we serve to really prioritize the health issues our communities are facing. And then once we have that community needs assessment, our caregivers then work alongside our community partners to design and deliver programs that directly address those needs that have surfaced in that community needs assessment. In fact, just last week, Providence Little Company of Mary in partnership with the Lawndale Elementary School District, opened a wellness and activity center designed to offer free health education, vaccinations, and a variety of activities that will help improve the physical, mental, emotional, and spiritual health of the children within that community. I think one other thing that's exciting, we're partnering with the LA County Department of Public Health to visit more than 8,000 homes in Wilmington to identify household needs and connect families with health and social service resources that they may not know about and may desperately need. I think, as demonstrated by these efforts and examples, local partnerships within our communities are really essential to improving the overall health of those communities that we serve.
Well, community partnerships are absolutely vital, and you are making a difference. So we thank you for that.
Thank you.
Let's shift gears a bit. Insurance plays an important role in getting patients in the door. Roger, what changes are you seeing in the insurance landscape?
So as you heard at the beginning, that almost all of us will agree that we are seeing increasing trend of insurance companies not paying the cost of care. Now, what happened in the last few years is that insurance companies' primary business model was governed by growth in managed care, growth in Medicare Advantage, growth in commercial. As the growth is tapering off, the margins are squeezing. And the insurance companies are responding a couple of ways. One is they're transferring the risk to delegated medical groups, and it has its own play. Delegated medical groups assume the risk, and they also control physicians in the market, either through IPA structure or through an employment model. So they have now two things in their hand. An insurance company had pricing power, the ability to influence the price that they pay for the services. The delegated medical groups have two influences. A, they control the price, and they also can control the steerage to your facility. So this is creating a very unique challenge for the healthcare system. Now, the insurance landscape is going to change as these margin pressures come. Some of them will exit some of the markets, and some of them are trying to exit Medicare Advantage. But the bigger question is, how do we respond to it? And one of the biggest challenges that healthcare systems have is we engage in a business in which we do not have any pricing power. Every other business has ability to price their services. We don't. So the way to do this is that we engage in dual risk. We assume the role of delegated medical groups, and we take the risks directly from the insurance company. That gives us ability to gain back some pricing power. Again, we have to be efficient, and we will have to continuously evolve to make sure that we are able to deliver the care within the means that we have. But I would say bigger than the insurance landscape shift, the shift will take place in the healthcare systems trying to get a foothold and develop their own delegated models and own medical groups and assume risk.
Wow, that is really interesting. It sounds like a quite a task and challenge to for the future. Yeah, there's another sector that's very topical currently. Let's shift our focus to technology for a couple of questions. Dr. Lopez, how is digital innovation revolutionizing healthcare?
Digital innovation is truly transforming healthcare as a whole. It is touching every phase of the healthcare delivery system, from how patients access care, or how physicians practice medicine, and how hospitals interface with patients, doctors, and the community as a whole, both internally within their operations as well as at the bedside. The use of countless devices has dramatically expanded over the last several years, allowing for remote connectivity between all of the different components of healthcare. There was a time when pagers was the only way that I could communicate with my hospitals. And now, of course, through the use of other technologies, communication has become not only more integrated, but also more effective. At PIH Health, our dedication to excellence in digital health has been in existence for over 2 decades. recognizing that as the health system is transformed, that technology has to be at the core of what we do. It has allowed us in some instances to reduce costs, but primarily to increase efficiency, and more importantly, to enhance the quality of care that our patients receive and enhance the safety within which our providers practice. We're obviously constantly looking for ways to improve this. As was stated before, AI and other technologies will be extremely helpful in improving how our healthcare systems continue to evolve. Digital technology, I believe, is going to be at the core of everything that we do, making it easier for patients to access care, for physicians to practice medicine, and certainly to be able to ensure that patients are receiving the right care at the right location at a time that is most convenient for them. So it is going to be transformative in every phase of medicine, I believe. And as innovation and technology and as technology per se grows and becomes more embedded in our healthcare systems, I believe that's only going to help communicate better, treat patients more effectively and more efficiently, and hopefully decrease the wait times that unfortunately many of our patients have to endure as they come to our facilities, be there emergency departments or doctor's offices or our hospitals or other areas of our organization. So that is clearly one of the focus that PIH Health has, also to make access more customer friendly and ensure that those interactions are more efficient and effective.
Well, it certainly sounds as if you have the formula, and it is true. It is becoming so much easier for a patient to navigate appointments and results and labs. So this is only a positive for everybody. Great information, Dr. Lopez, which leads me to the hot topic of AI. Janice and Michael, where do you believe that AI will prove most effective in helping us transform healthcare, and where do you have the most concerns? Janice, let's start with you.
Thank you. Well, as I look across the UCLA health system and with our work with at the university, our Department of Computational Medicine, we've actually been using different AI tools for many years. A lot of them we used during the COVID-19 pandemic for predictive analytics that our computational medicine team was deriving. Additionally, we use some tools in radiology, we use them in anesthesiology, we use them in some of our infrastructure services as well, like compliance. And as a major academic health system, one of the things that we're recruiting for right now is a chief health AI officer to look at how we can really most effectively and safely use a lot of the new tools that are coming on the market. We've all seen a real proliferation of tools by vendors on different types of things, and we want to make sure that those are really appropriate for use in our patient population and actually do bend the curve on improving quality and safety. And really here, we see it as our responsibility to lead innovation, our faculty and staff with Health HI. We have a whole innovation and biodesign center. Every year we fund 10 of our most promising faculty and staff to be innovation fellows. So they're working on different aspects of that. And one of the things that we feel is, although it does hold a great deal of promise, it also comes with some inherent risks. And so we've established a Health AI Governance Council, which brings together experts from our organization to ensure we complete an in-depth assessment of all AI tools prior to implementation to ensure they are safe for use and that the tools work as expected. We also want to make sure we're disclosing to patients when portions of their care have been assisted by AI. And so even in every aspect of it, we want to bring that to our Patient and Family Technology Advisory Council, which we've had in place for years, to really get their feedback on as we go forward. So definitely a lot of risks, but what we see as well is a lot of great opportunities.
I mean, Janice, a chief health AI officer, who would have thought that 10 years ago? Michael, why don't you weigh in on this?
Yeah, thank you. I'll go reverse order and do the concern, first. I think my biggest concern is crossing that fine line of artificial intelligence and human involvement or human intervention. I think that relying exclusively on AI at the expense of that human intervention can be dangerous. But if you leverage the human intervention involvement with AI, I think great things can really be accomplished. So I'd say that's kind of my concern, in addition to the elements that Janice brought out as well. On the positive side, I think that the main benefit and promise of AI is the ability for it to leverage this large language models and then generate logic out of it. Meaning, if you're a researcher, you can create the logic or theory you want to test and then have AI do the computational work of really deciphering if the logic or theory really holds, which can be extremely powerful. I'd say, one project at St. John's, we had this digital me project that really pairs the St. John's Cancer Institute's clinical innovation engine with Providence's genomics data science capabilities to build, test, and launch what's called a cancer digital twin tool. It's pretty remarkable. So these digital twins represent a move to that N of one medicine, where you're leveraging advances in AI and machine learning to create a digital avatar of individual patients that allow treating physicians to simulate the outcome of different potential treatments before suggesting them to the patient. So by providing clinical decision support personalized to each individual patient's unique biological context, this digital me represents the future of personalized precision cancer care, which is very exciting. So there's limitless opportunities with AI, and it will be safe, and if done the right way, combined with that human intervention and involvement.
I mean, so well said. It's great to hear that both of your teams are implementing innovations in a careful, smart, and thoughtful way, but the possibilities that you're talking about are so exciting and limitless. So looking forward to see what happens in the future. Thank you both. Roger, I'm going to come back to you here. Will outpatient care continue to trend upward?
Absolutely. And the reason is there are some very strong currents that have been influencing the move towards outpatient care. First is the advancement in technology. It is truly safer, or at least equally safe, to provide certain diagnostic and surgical procedures in outpatient setting. So that evolution was quite natural. The second is the care is more affordable and efficient in outpatient setting. And bending the cost curve is one of the needs of the healthcare systems. So it, again, is a major influencer that will continue to influence it. And third is the care is naturally going to evolve in the next few decades away from institution towards home. So it's a path towards that. Any procedure that is done in outpatient setting, the patients return to home quickly. There is another influencer. So I would say it is going to continue because of the factors that are influencing it. And the key for the hospital systems will be to keep building the capacity outside the walls of the hospital to gain from those trends. And the trends are very clear. The growth in outpatient is almost twice the growth that is expected in inpatient setting. So I would say yes. Wow,
that's amazing. The growth in outpatient is twice that. Thank you. Speaking of trending upwards, let's address equity and access. Janice, what can or should be done to improve healthcare equity and access to care?
Well, thank you. It's such an important part of everything we do. Healthcare equity really, to us at UCLA Health, is a vital component of providing excellent care. Our goal is really to meet those unique needs of each patient in a culturally sensitive, respectful manner and with shared decision-making. So one of the ways we've worked to hardwire these principles into such a large healthcare organization is by adopting a clear health equity standard, such as those recommended by the Joint Commission Healthcare Equity Certification. And we were proud a few months ago to be the first health system in California to be to receive this distinguished certification by the Joint Commission. And what it really reflected on is over the past 3 years, with our Chief Health Equity and Diversity Officer, we've worked to create a framework and a roadmap that really reflects our commitment to providing high quality, equitable care to our patients and to the communities that we serve. And ensuring that equitable access also requires our work in removing barriers to access that we know are inherent in our system. It also requires us to optimize and expand our capacity, but also work with the health plans, as was mentioned earlier, with the medical groups and governmental agencies to remove that unnecessary administrative and financial burden that may prevent patients, especially those who are most vulnerable, from receiving the timely care that they need. Additionally, we know, despite us having 260 clinics throughout the region, a very large federally qualified health center through the Venice Family Clinic that we operate, we still have patients who do not seek care. So one of the things we launched 3 years ago was really taking a primary care clinic out in a mobile van. We have the UCLA Health Homeless Healthcare Collaborative, and we go to the encampments in Los Angeles, all the areas where people experiencing homelessness are, and bring that primary care clinic to them. One of the benefits of that is we've seen about a 37% reduction in unnecessary emergency room visits by that patient population through the use of taking the mobile vans out to them. So we were successful in showing that data to the state and receiving a CalAIM grant to support further expansion of that. So we continue on that journey. We are challenged definitely with having such a large population in Los Angeles to serve, but we continue to look for unique ways to do that.
Wow. And you certainly are. I mean, this is amazing doing these mobile vans. Great work. Dr. Lopez, another way we can keep moving forward is to learn from experiences. What can the healthcare sector do to prepare for a potential future crisis, such as another pandemic scenario?
Supply chain challenges that peaked during the COVID-19 pandemic was only the tip of the iceberg. Obviously, we saw shortages of supplies throughout the system. We saw limitation in terms of the ability to recruit and retain healthcare workers to meet the challenges that we had at the time. So PIH Health is doing its very best to ensure that we become a resilient health system and prepare appropriately for a future crisis such as this. So we're partnering with multiple organizations to strengthen our supply chain and logistics. We're bolstering and increasing our relationships with vendors and adopting innovative solutions to really achieve a level of sustainable supplies, and whether it's pharmaceuticals, medical devices, or other areas. We have also been looking at ways to reduce waste, to conserve supplies, and to prepare for those eventual shortages. As we speak, and many of my colleagues know, we already have shortages of key pharmaceutical supplies and other kinds of supplies that we use daily in how we take care of patients. So we are already there in a way, and thus we're continuing to invest in our workforce, prioritizing our training programs, recruitment and retention for healthcare workers, including physicians, and every aspect of what we do to improve in how we address their mental and emotional well-being, because we have dealt with extremely difficult crises, as everyone knows. So we are prioritizing how we deploy our resources to meet those needs, focus on education, expansion of our workforce, as I said, and helping us become better equipped, having sufficient ways of sharing resources between and amongst our 3 hospitals, as well as partnering with other organizations. We participate with Vizient, a national organization that is helping us procure appropriate supplies. Recently, we have a shortage of blood culture bottles, as an example. So every day it seems like, as it was the case with COVID, we're having to deal with this kinds of shortages. And so not only are we preparing to deal with them today, but as you indicated in your question, we know that another COVID-like crisis is in our future. And I think collectively, all the health systems around the country are dealing with those challenges and doing a lot of the things that I mentioned to try to prepare and deal with them when they come.
Well, that is excellent. It does sound like you guys are on the ball and have addressed all of these issues. Michael, you have a very important perspective on this next issue. The regional healthcare workforce does not reflect the diversity of Los Angeles. Michael, what strategies are being employed or should be employed to attract more diversity to the profession?
Yeah, that's a great question. I think that, increasing provider diversity really requires, strategies that are kind of across the continuum, strategies that focus on current providers, students in and considering medical school or nursing school or other technical professions within healthcare, and obviously youth just starting their academic journeys. Providence has established what we call these physician resource groups that provide a support network and a collective voice to help strengthen the bonds to the organization and to the profession. Initially, our first physician resource groups really include the Black and Hispanic, Latinx, and AAPI communities. And for organizations not large enough to provide these physician resource groups, there are national associations such as the National Medical Associations for Alternatives. I think by supporting medical students through various ways, including scholarships, medical student placement, and mentorship, we can really ensure that the pipeline of diverse physicians and other clinical providers really stays strong. I think recently I was reading up on Michael Bloomberg's recent $600 million donation to support medical students at HBCUs across the country. And that's a recent and dramatic example of the kind of support that needs to happen. Providence, we're working to continue to expand our partnership and support for diverse medical students, both within our geographical footprint and nationally as well, since we're a national-based health system. Two last things that I'll point out that I think will help is, one is these community health workers. CHWs are so valuable, and they've been proven through the decades of research to be really effective in reducing healthcare inequities and disparities. But also, the CHW role provides a low barrier entry into health careers. And at Providence, we're investing heavily in CHWs in all of our care settings and are glad to see their work is really beginning to be reimbursed by our payers. And finally, if we don't meaningfully engage the younger generation, that K through 12 generation from diverse communities with health professions, we'll still be having this same conversation years from now. At Providence, we have a strategic partnership with the TGR Foundation, which through its learning labs inspires tens of thousands of students, 90+% of those students being from minority communities, to explore STEAM education and careers, those educations in science, technology, mathematics. And Providence provides, providers at all levels have worked with the TGR Foundation, both on one-on-one and in group professional experiences that are critically important to diversifying all the STEAM professions and especially medicine as we move forward. So very excited about the opportunities of these early interventions, working with kids in that K through 12 up through adolescence, and then providing opportunities at the university level as well.
Well, those are tremendous things that you're doing in that area, and congratulations for that. Okay, our time is short, so we're going to skip to our final question for the group. What is one thing that should be done today to enhance the patient experience? And I will start with Janice.
Well, thank you. That's a great question and something we're all working on 24/7 in our health systems. And really, patient safety is the foundation of the positive experience as well. And one of the things that we've invested in heavily over the years at UCLA Health is not only our quality and safety program, but our program to really train staff at every level on how to most effectively interact with patients. We have a program called We Listen, We Care that really involves all care providers, all ancillary providers, to ensure that patients feel safe in our care and building a trusting environment. We really want to make sure we're connecting on a human level, opening the door to conversation with our patients and empowering patients in their care. I would say when patients come to UCLA Health, they know they're coming to get care from experts, but what's most meaningful to them is that they're treated with kindness, compassion, and respect. And above all, that's what they remember about their care.
Oh, that's great. How about your thoughts, Roger?
Very similar to what Janice mentioned. When patients come to our institutions, their expectations are very simple. Treat me if you can, don't hurt me, but treat me with kindness. So we focus a lot on quality, we focus a lot on safety, we focus a lot on affordability because of the nature of our community. But there are two elements that we are trying to add to the patient experience. We think the patient needs high quality, safe care in an affordable environment. And most of our mission statements kind of focus on this. But there is a new thing that patients, I think, in our community, particularly which are dealing with access issues, they want access and coordinated care. I believe the new disruptor in healthcare will be the one who will solve the issue of access and coordination of care. So we are adding those elements because what family and caregiver needs is there someone to help me to coordinate the care for my mom? And that aspect from the patient angle is becoming increasingly important for us.
Nice. Michael, please weigh in.
Yeah, I think Janice and Roger have really summed it up and summed it up very well. I'll just add briefly that Providence has a motto that I love. We have an amazing mission, vision, and value statements and so forth. But I love our Providence promise or our motto, and it says to know me, care for me, and to ease my way. And I think that if we could do that every time in every interaction, every encounter with patients, get to know them, care for them, and ease their way, and we would really elevate the healthcare experience of our community and of our patients throughout this entire nation. And I also agree with Roger. It's interesting. A lot of times organizations focus on the patient's experience once they're inside the walls of our hospitals and clinics and so forth. But building on what Roger said, access is still very intimidating. I've been in healthcare for nearly 28 years, and still sometimes getting an appointment or understanding the healthcare bill and my copay and all that can even be challenging for someone that's been in this for quite some time, and someone that hasn't had the education or the experience. I can only imagine how intimidating healthcare continues to be. And it's sad and unfortunate because we offer some of the best healthcare in the entire world. But if people don't access it in the right way or don't have the ease of accessing it because of the intimidation factor and the fear and the lack of education and the unknown, we're not going to have the ability to improve the healthcare status of the communities of what we serve. So hopefully we'll continue to obviously stay focused with inside the walls of our organizations, but find ways to enhance the experience when our consumers and patients are trying to access our organizations as well.
Beautiful words, Michael. How about you, Dr. Lopez? Let's close this with your words.
Thank you. So patients first. That's our common objective at PH Health, to ensure that we define the patient experience and how well we take care of our patients as measured by how we would want to receive care ourselves and how we would want every member of our family and loved ones to be treated. At the end of the day, that patient experience needs to be defined by the patient receiving the right care in the right location at a time that is most convenient for them. That includes obviously reaching out to them. Not many of our patients can come to us, and so we have an ability to reach out to them through virtual visits. And as has been stated, we have a very comprehensive care team that is able to touch patients through the entire continuum. And that element of care coordination that we have continued to refine and improve on allows us to reach out to patients wherever they are and whatever is wrong with them. We partner with numerous federally qualified health centers, urgent cares, outpatient offices, obviously our emergency rooms in our hospitals, but we don't forget of our patients once they leave our hospitals. We continue to reach out to them in every means possible, depending on where they go and what resources they have to be able to see us again. Because that experience, the ability to follow patients over time, whatever is wrong with them, is what defines BIH Health and its ability to really care for patients where they are. Access is a universal challenge in all of our healthcare systems. So we're doing everything possible to get to a point where access for our healthcare services can be equal to what Open Table would be in the hospitality business. That is our goal. That's where we're going. And we're not going to rest until we're able to achieve those objectives, to be there for our patients and to make their experience with our physicians and our hospitals as simple, as seamless, and as customer friendly as we can possibly make it.
Tremendous and inspirational words from all of you, knowing that you are listening to the patients and that you really care about them both in and out of the hospital. Well, thank you all so much. It's been a privilege moderating this roundtable today. I have so many takeaways from the conversation, and I know that our readers will too. Josh, I'm going to hand it back over to you.
I want to thank all of you so much for being a part of this. That formally concludes our roundtable discussion. Dr. Lopez, Michael, Roger, Janice, thank you again for sharing your insights, for your knowledge, your expertise, and for helping navigating through all of these changing times. We look forward again to our next conversation. Until then, stay safe, stay healthy, everyone. Have a good day.